A man coughed out a blood clot in the shape of his lung. This is an explanation of what happened. References to where I took this information from will be in the description below. Let's get into it. A 36-year-old man with a tumultuous medical history was admitted to the ICU presenting with an acute exacerbation of chronic heart failure. Acute exacerbation meaning the sudden worsening or the severity of a condition, and chronic heart failure, which means the long-term inability of the heart to pump the right amount of blood throughout the body, severely affecting the upkeep of the body's oxygen demand. Because of this, a ventricular support system known as an impeller was used to help pump the blood more effectively, alongside an infusion of heparin to stop the blood from coagulating. However, in the next few weeks he started to have small bouts of hemoptysis. Hem referring to the blood, and tysis referring to spitting or coughing up. Putting these words together would mean the coughing up of blood. Now because of this, the patient was in respiratory distress and consequently led the staff to increase the amount of oxygen given via nasal cannula. With his cough worsening and increasing in frequency, the patient expirated what seemed like a blood clot in the anatomical shape of the right bronchial tree, measuring more than 10 centimeters in width and height. To check what may have caused this, the patient was intubated, and bronchoscopy, a procedure used to visualize the airways, was used. The bronchoscopy showed a small amount of blood in the basilar branches of the lower right lobe, giving an idea of what might have happened. What made this even more complicated was the infection that the patient presented with during this whole ordeal. However, even though any further episodes of hemoptysis had disappeared, the patient had died 2 weeks later due to complications of heart failure. What makes this case interesting is how well preserved the blood cast is. Blood casts occur when blood leaks into the anatomical structures, taking on the shape of the structure once the clot has occurred. Dr. Georg Wieselthaler, the transplant and pulmonology surgeon who had taken care of the patient, had recorded his findings of this case in the New England Journal of Medicine. He had stated to The Atlantic on how surprised he and his team was. Quote, "We were astonished. It's a curiosity you can't imagine. I mean, this is very, very, very rare." While being rare, blood casts are known to occur in the bronchial tree, as well as the tubules of the kidney, and this cast does indeed show how detailed the inner workings of the airways truly are. In this case, you could clearly see the intricate design of the different segments of the lung, showing its bronchi and its bronchioles. Dr. Wieselthaler had highlighted the various segments via different colored arrows. The 3 segmental branches of the upper lobe are shown with blue arrows. The 2 segmental branches of the middle lobe are shown with white arrows, and the 5 segmental branches of the lower lobe are shown with black arrows. To understand how this may have happened, we need to further understand the patient and take into account his history and what this all means. His medical history included heart failure with an ejection fraction of 20%, bioprosthetic aortic valve replacement for bicuspid aortic stenosis, endovascular stenting of an aortic aneurysm, and placement of a permanent pacemaker for complete heart block. Let's break this down. History of heart failure with a low ejection fraction of 20%. Ejection fraction is the amount of blood that is pumped out of the left ventricle or the lower left heart chamber in each contraction. However, not all the blood in the ventricle is ejected, and the amount that is ejected is expressed as a percentage. The normal ejection fraction is about 55 to 60%. With the patient's ejection fraction being at a low 20%, his history suggests a continued struggle for his heart to keep up the oxygen demands of the body, which does tie into his chronic heart failure. He had previously been treated for bicuspid aortic stenosis. This refers to the aortic valve. Normally, the aortic valve sits between the left ventricle and the aorta. It helps direct the flow of blood in one direction from the ventricle to the aorta, and this delivers the blood throughout the body. the valve is normally presented with 3 cusps or flaps, having the name tricuspid. However, this patient had bicuspid valve, or 2 flaps or cusps, which is an inherited condition. This has many of its own issues, but one of the major issues is the impairment of the unidirectional flow of blood, causing the blood to flow back into the heart. Individuals who have bicuspid valve disorder, it is also common for the aortic valve to become much more narrower or undergo stenosis over time. Both of these issues mean that less blood is being pumped overall around the body and has put the heart under extra stress, which can lead to cardiac changes. In order to mitigate the resulting stenosis and to normalize the impeded blood flow, he had his valve replaced with a bioprosthetic one, which functions similar to a normal tricuspid valve. Endovascular stenting of an aortic aneurysm. Aneurysm refers to a permanent dilation of a segment of a vessel, leading to parts of the vessel to weaken, and is caused by various factors. These affected areas find it hard to withstand the pressure created by the blood, causing part of the vessel to balloon and eventually burst. This leads to the loss of blood, putting the patient into shock, which is a dangerous condition to be in. And in this case, it's the aorta, the main artery of the body, making it all the more dangerous. Now, to avoid any of these complications, the patient had stenting done. Stenting refers to a placement of a stent, which is a plastic or a metal tube. It expands in the affected vessel, reducing the pressure load on the aneurysm, which in turn reduces the chances of the vessel bursting. Placement of a permanent pacemaker for complete heart block. Complete heart block occurs when the electrical impulses can't pass from the upper chambers of the heart, known as the atria, to the lower chambers, known as the ventricles, preventing any correct rhythmic contraction of the heart, and as a result, impedes the function of the heart to pump around the body. Normally, electrical impulses are generated by the SAN node or the sinoatrial node. It is located in the upper right heart chamber known as the right atrium. These impulses are conducted to the ventricles by the AV node or the atrioventricular node, which is located between the atria and the ventricles. The electrical impulses stimulate the atria and the ventricles to contract, giving the heart its pumping action, and the nodes themselves help set a rhythm for these contractions. However, in complete heart block, the AV node doesn't conduct these impulses, and as a result, a backup system takes over, helping the ventricles to still contract. The problem here is that the backup system has a much slower rate at which the ventricles contract, thereby slowing down the heart rate. This in turn reduces the flow of blood to vital organs, such as the brain. To refix this abnormal rhythm, a pacemaker, a device which generates electrical impulses on the heart muscle, is used to correct the abnormal rhythm. In conclusion, at the young age of 36 and with such issues, there is no surprise with the amount of complications that can possibly occur. However, the question of how the blood cast happened and why it was so well preserved still remains. We can piece together what may have happened by looking into the patient when he was first admitted. The patient was put on a ventricular support system to help with his failing heart. However, a downside to using this device is that it requires the blood to come into contact with non-biological parts of the device. And when it does, it activates the adhesion of cells known as platelets, leading to the formation of a blood clot. A blood clot is a clump of blood in which the blood has become more semi-solid or jelly-like. Now, within the body, blood clots have a normal physiological role. They prevent hemorrhages or blood leaking from ruptured vessels by strengthening it in instances where the vessel may be weakened due to an infection or disease. They do this by acting as a patch or plug in that weakened area from where the blood leaks from. Now, in certain conditions, blood clots can also have a detrimental effect in the body, as they can obstruct vessels, leading to organs or tissues of the body being deprived of oxygen-rich blood. This is due to many factors, of which are genetic, environmental, gender, and age, and these clots tend to be much bigger than in normal ones. In the situation of the patient, blood clots forming within the support device meant that it can cause obstruction within the machine, which interferes with the function of the support system. So, in order to resolve this issue, heparin was given. Known as an anticoagulant or against coagulation, it stops the formation of blood clots, preventing the adverse effects of the ventricular support system. The issue being that the action of this anticoagulant or blood thinner can lead to a higher chance of blood leaking from weakened vessels due to less clot formation. So if we add the patient's weakened state when he had entered the hospital in addition to his turbulent medical history, we can deduce that after the heparin was given, it reduced the effective clotting mechanisms in the body, thereby increasing the chances of blood leaking from weakened vessels. The blood had most likely been leaked from the branches of the basal arteries of the lower right lobe, as the lungs tend to be more vulnerable in cases of chronic heart failure, and this hemorrhage was confirmed by bronchoscopy. However, the question still remains why the blood cast itself was so intact, and why it didn't break into pieces as the patient coughed it out. You have to remember that this cast had to travel from the lung up the trachea and then enter the oral cavity to be coughed out, and judging by the size of it, it wouldn't be a surprise if it came out in pieces. The answer may lie in a protein called fibrinogen. Dr. Wieselthaler had suggested that due to the infection and the general condition of the patient, the amount of fibrinogen in the blood had increased. This is because fibrinogen helps promote blood clots. It's a procoagulant, which means it prevents blood from being lost due to vascular injury. It does this by forming a meshwork and trapping platelets, thereby forming a clot. So as the blood took up space and started to make the shape of the bronchial tree, as well as the effect of heparin wearing off, the fibrinogen helped the blood to coagulate, making the cast, but also making it well preserved. In addition to this, because the airways was occupied by this, it led to the irritation and overall decreased ventilation of the lung, causing the reactionary episodes of coughing. The increase in fibrinogen would also explain why the cast was pretty much intact. Its strong reaction meant that the clot or the cast wasn't broken into pieces as the patient coughed it out. As Dr. Wieselthaler had stated to The Atlantic, the blood in the airways was unusually rubbery, capable of surviving the bumpy ride up the trachea unscathed. However, as I stated before, even though the medical team was able to stop the bleeding and put the patient on a breathing tube, the patient sadly passed away due to other complications. Blood casts are normally more frequent in the kidney, where blood leaks into the glomerulus or tubules. However, rare cases do show blood casts being in the bronchioles and the alveoli. It is unfortunate that this patient had presented with such issues at a young age, making it a very rare case. Other cases which have shown blood casts will be linked in the description below. This was my very first video, and thank you for tuning in. Let me know what you guys thought of the video and of the case in the comments below. I would like to give a shout out to Chubby Emu, whose work has inspired me as a student. His work is pretty amazing, and if you don't already know him, then you should check him out, especially for interesting medical cases. Chances are you probably already do know him, but in the very small chance you don't, then his channel will be linked below. Thanks again, and I hope you all stay safe.